From Lagos, the nation's commercial capital, this is the news at 10, live from Channels Television. Reported tonight, Ijoma Oyato.
Hello and welcome. Tonight, alleged 100 million naira cash gift to Chibok parents sparks off new controversy in the community. Presidency denies allegations. Lagos government clears First Consultants Medical Center of any complicity in managing the Ebola case, says all their actions met professional expectations. Boko Haram kills 8 people, blows up link bridge between Damaturu and Buniyadi, their stronghold in Yobe State. And more than 100 Palestinians are killed after Israel bombarded Gaza. And on business news tonight, financial markets and other businesses in the country reopen tomorrow after a 2-day break to commemorate Eid al-Fitr.
And on sports news tonight, Nigeria is on the verge of losing one of its gold medals at the 2014 Commonwealth Games as Chika Malaha becomes the first athlete to fail a drugs test in Glasgow.
A new controversy is brewing in Chibok village in Borno State, with parents of the abducted girls alleging that they've been shortchanged by Chibok community leaders who allegedly received 100 million naira cash gift from the presidency on their behalf. While the president's special advisor on media and publicity, Dr. Ruben Abati, dismissed the allegation, saying no one was given any money at the presidential villa. In his words, there was no time after the meeting when envelopes were distributed or money was given. He said the president is not part of and will never do anything to bribe anybody. This issue is not about money. We're talking about human lives here. Dr. Abati also said that this is a very serious matter and they'd like to appeal to those who want to play politics with it, using all kinds of tricks to ridicule the efforts of the administration, to always appeal to their individual conscience and realize that what they're dealing with here is a very serious matter and not one of mischief. However, one of the parents of the abducted girls, Mr. Abdul Halidu, told the BBC that he got only 200,000 from the money. And now the parents of the missing girls are saying that the amount shared to them is unacceptable. According to Mr. Halidu, I got only 200,000 naira out of the said 100 million naira. Some of us got 300,000 and some less than that. Our leaders in Abuja are using the girls to enrich themselves, and this is unacceptable. End of quote. In the meantime, one of the leaders of Kibaku community in Chibok, Mr. Alan Manasseh, dismissed the allegations as unfounded, insisting that no cash gift was received from President Goodluck Jonathan during their visit to the villa. He said the Chibok leaders are responsible people who would not divert monies meant for the aggrieved parents.
Actually, it's so unfortunate that issue of money is coming at this point in time, because when our people are coming to see Mr. President, nobody was expecting receiving a dime from Mr. President. Nobody was even ready to receive money, because I could remember the last time the wife of the governor, Mrs. Nana Kashim Setima, went to Chibok. He tried to, she gave 1 million naira for the women in Chibok to help them buy drugs, especially those that are having blood pressure related cases due to this issue of trauma. But the parents refused to collect that 1 million up to today. That million is still in the hand of somebody in Chibok, waiting for when these girls will be out. Then the parents will now use this money in something else. You know, but on coming to Abuja, we went to Mr. President, met with Mr. President, went back to our hotel rooms, And when our people were there in the hotel room, we heard in the morning that somebody came, a senior special assistant to Mr. President. He brought some money and then give the girls and some of their parents, you know, which to us, most of our community leaders are not even aware of it. So it is, even if Mr. President wants to give something to the community, we know which the community are in need. Some are displaced, you know, because several attacks are still going on in communities. Some need money to build houses, some need money to buy mattresses to sleep, some even need money to feed because they are displaced, they don't have food, which is normal for Mr. President to help. But we were expecting, if succor is coming from Mr. President in terms of money, then the money should be given to the leaders of the community to take it to the community and then give the people that concern. Not for one special assistant of Mr. President to come out and start sharing money midnight to people. This is not acceptable. And by the way, we don't even know how money was given, how much was given to Chibok community. We are just hearing.
Meanwhile, the Bring Back Our Girls campaigners have taken a swipe at the federal government for allegedly giving 100 million naira to the families of the abducted schoolgirls from Chibok community. The group urged the federal government to confront the challenge before it like other countries would, rather than always believing that money would solve everything. They also urged the federal government to treat the abduction of the girls with the required urgency and return them to their families, rather than trying to silence the families with money. The group, which has been sitting out to protest the abduction of the schoolgirls, vowed to continue to hold their protests until the girls are rescued.
What is 100 million naira to the government? Nothing. Why you giving them? And you cannot, everything cannot be done with money. Money cannot buy anything. You know what it is for a child? We have future Dangotes and Ergotes in that group. We have future Nigerians that will do more than 100 million naira. So it is not about giving them money. It is not about paying. I think we've gotten to a place in this nation where all we think about is that when we give out money, it will be solved. It will not be solved. And that we have consistently said, why are we here? Bring back our girls now. What is the reason? Chibok girls. We are here for the Chibok girls. Whoever is holding the Chibok girls, whoever decides to not talk about the Chibok girls again, we are here for the Chibok girls, and that is what we will maintain.
Once they have chosen popularity over effectiveness, what they now do is to face challenges with silence instead of condemnation. It is to confront emergencies with confusion instead of preparedness. It is to face uncertainty with fear instead of courage. So this is exactly what is transpiring here. Because I cannot believe Cameroon will go and get their own rescue their prime minister's wife. It doesn't mean how important the person is. They have rescued their own citizens, and we are here for over 200 children missing, and Nigeria, the giant of Africa, with military that is well equipped, and we are here every day. These children are still missing. They are still in the wilderness. It just gets you to wonder. It's sad. It's a shame, really. It's a disgrace to this nation.
While staying with some security matters, the Boko Haram sect has killed 8 people and blown up a bridge in Yobe State, Nigeria's restive northeast region. Residents say the insurgents stormed Katako, a town on the outskirts of Damaturu, the Yobe State capital, around 7:30 p.m. yesterday, attacking the military base there before killing 8 people. The insurgents also blew up the Katako bridge, linking Damaturu to their stronghold, Buniyadi, the capital of Gujba local government area of the state, which connects Yobe and neighboring Borno and Adamawa states. This is the first time Boko Haram militants are attacking Katako since the commencement of serious hostilities by the insurgents in 2009. Meanwhile, 2 Boko Haram suspects have been arrested in Damaturu metropolis. Authorities there allege that the suspects were in possession of improvised explosive devices. Well, we'll move on to health issues, and now for the first time since a man died of the Ebola virus in Lagos, First Consultants Medical Center, the hospital where Mr. Patrick Sawyer died, has been speaking about all it did to ensure that the spread of the disease was curtailed and the infection rate eliminated. The hospital admitted Mr. Sawyer with symptoms of suggestive malaria, and those symptoms were fever, headache, and extreme weakness. The hospital says the victim was confirmed positive for malaria, but came out negative for hepatitis B and C and HIV tests. But it started to conduct further tests since Mr. Sawyer was not responding to treatment and was developing hemorrhagic symptoms. The statement adds that although Mr. Sawyer denied being in contact with any person with Ebola, it decided to test him for the virus, bearing in mind that the victim was coming in from Liberia, where there's been an outbreak of the disease. First Consultant Medical Center said that it immediately quarantined the patient and commenced barrier nursing, and simultaneously contacted the Lagos State Ministry of Health and the Federal Ministry of Health for additional laboratory tests based on its suspicion of Ebola. First Consultants Medical Center adds that it resisted immense pressure to discharge Mr. Sawyer from the hospital, despite insistence that the Ebola victim had an important role to play at the ECOWAS convention in Calabar, the Cross River State capital. According to the hospital, the initial results from Luth Laboratory indicated a signal of a possible Ebola virus, but required confirmation. First Consultant said it then went further to contact senior officials in the Office of the U.S. Secretary of Health, who assisted with contacts at the Center for Disease Control and the WHO Regional Laboratory Center in Senegal. The hospital adds that working with the state, federal and international agencies, it was able to obtain confirmation of the Ebola virus disease. According to the hospital, the gentleman subsequently died at 6:50 a.m. on July the 25th, and all agencies were properly notified. The hospital was then shut down with the immediate evacuation of in-house patients, while it removed and cremated Mr. Sawyer's body under WHO guidelines witnessed by all appropriate agencies. Part of the statement reads, "In keeping with WHO guidelines, the hospital is shut down briefly as a full decontamination exercise is currently in progress. The reopening of the hospital will also be in accordance with WHO guidelines." End of quote. Now, staying with the Ebola story, the Lagos State government has thrown its support behind the First Consultants Medical Center. The special advisor to the Lagos State government on public health, Dr. Yewande Additional, told Channels Television earlier today that the hospital took all necessary precautions in caring for the victim who died last week.
The hospital First Consultant was fantastic in handling this man's situation. And I'm grateful to God, if I can say that was the hospital he went to. Because I'm not sure that a lot of our hospitals were really truly prepared. They were so prepared that they had the personal protective equipment on their facility. So the minute they saw that this could be Ebola, all their staff taking care of the man went into the gadgets, and that's what they were using to taking care of him. And the period of exposure, the 24 hours, they did blood tests and all of that, you know. The general blood test that would show that his system was shutting down was not visible in the blood test, and those are the things that we're kind of putting together scientifically to say that he probably wasn't contagious until after he got into the hospital where he was in isolation. The hospital is locked down in the sense that he died while in the hospital. So there is the sense, although it is not common to be in the same room, if you didn't touch him, chances are you wouldn't get the infection. But some of the staff might have attended to him that would have gone around the rest of the hospital in those first 24 hours. There were other patients on the wards that they might have attended to. Unfortunately, again, the hospital observed precaution that the staff were wearing gloves. So we know that we have a lot of prevention system in place at the hospital, which is very, very reassuring.
Special Advisor to the Lagos State Government on Public Health, Dr. Yewande Additional. Now in part 2, after the break, holidaymakers return to base after the Eid al-Fitr celebrations. That's coming up in a moment.